Hello and welcome back for episode 31 of the Newbie Dentist podcast. I'm your host, Dr. Omid Azami. It is great to be back and releasing another episode for you guys. I've been back up to 6 days a week of work, and I've been trying to squeeze in some fantastic interviews with some amazing guests, and I'm excited to be releasing those interviews over the next few weeks. In this episode, I had the great pleasure of interviewing two of my mentors and two great young Australian dentists, Dr. Bharat Agrawal and Dr. Varun Garg. Dr. Agrawal is an aesthetic dentist and a multiple practice owner based out of Queensland, Australia, and someone who I truly admire. Dr. Varun Garg is a prosthodontist based out of Melbourne, Australia, and I was lucky enough to have him as a clinical demonstrator while I was a dental student at the University of Melbourne, and I'm even luckier to have him as a friend and a mentor now. This episode is full of dental pearls for the dental students and the young dentists listening. We discuss avenues of clinical success, seeking out appropriate mentorship, importance of structured CPD early in your career, how to work with your local specialists, and much more. I hope you guys enjoyed this roundtable format as much as I did. I think it creates a lot of great natural conversation, allows the guests to bounce ideas off each other, which creates a nice synergy. And so I hope you guys enjoy this value-packed podcast episode. Dr. Agrawal and Dr. Garg and I have partnered up to form the Newbie Dentist Study Club in Melbourne, Australia, and we are proud to be holding our first lecture on October the 29th, 2018. This lecture is called Introduction to Aesthetic Dentistry and hopes to provide valuable information on assessing, diagnosing, treatment planning, and executing aesthetic dental cases with aims of giving attendees actionable and practical tips that they can learn and apply the next day. So, if you're based in Melbourne, Australia, and are interested in attending this course, message me on Instagram or find us on Facebook at the Newbie Dentist Study Club page. I will have all the links in the show notes, including the Instagram accounts for Dr. Garg and Dr. Agrawal, as they produce some fantastic work. So if you guys are not familiar with their work, you can find it on Instagram and reach out to them if you've heard the interview, because they love to hear from you guys as well. So without further ado, enjoy the episode.
Hello and welcome to the Newbie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Newbie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
I'm here with Dr. Varun Garg and Dr. Bharat Agrawal. I'm really excited to have you guys here today. We've partnered up to run the Newbie Dentist Study Club, and we're holding our first lecture at the end of the month. And it's nice to have you guys in here today. We're going to talk about a lot of things, and I'm excited to kind of dive into a lot of topics with you guys and touch on a lot of points. It's exciting for me to do something in person as well, because usually I'm doing this online, and it's a different vibe in the room to have you guys both here today. So what I hope to do is kind of keep with the normal format of the podcast and start off with a bit of an origin story. So Varun, if you'd like to go first, just tell me a little bit about your background. I know you recently posted on Instagram like a little bio by yourself, which was quite enlightening to read. So I know you've been through a lot of things early on in your professional career. So if you want to just briefly walk us through, maybe since like you graduated dentistry in India and then you came over to Australia, what that's been like for you.
Thank you, Omid, for having me here. It's quite overwhelming to speak in front of the live audience, but I'll try my best to keep my horses under control. Now, I did do that bio on Instagram because it was a kind of a challenge that's going around, and one of my friends from Florida, he asked me to do it, and it was the hardest thing I had to do because talking about yourself is probably takes a lot more thought than you think. So, I was born in India. I was born and bred there, and I lived there. I did my dentistry in India, and then I decided to move. Now, the reason I decided to move was purely because the dental culture was very different in India.
Yeah.
There, you have a lot more competition, as you can imagine, because the population is that much. But also, the way dentistry is practiced, I just never saw myself doing dentistry after hours and having a Monday to Friday job at a uni and then coming back and having a clinic after hours. So not something that really appealed to me. And I was lucky enough to have a few friends from US and Canada, and speaking to them about how dentistry works in the countries where they were from, and I actually quite enjoyed the idea of that. So I started looking at where I want to be for the rest of my life. And one of my cousins was in Australia, and he said, look, the lifestyle is pretty chilled. It's really nice. And I was quite naive. Anything would have sounded nice to me back then. So I said, okay, well, I should try for that. We had some roadshow. Universities were coming to India and, promoting things. I had to sit for an interview, and I got a part scholarship to do masters in forensic odontology.
Nice.
So UWA, which is the university in Perth, offered me that.
Yeah.
And I was like, well, it might be an opportunity to leave India and go and see what Australia has to offer.
Yeah.
And this is how I ended up here.
So did you complete that?
No. So this is again.
So you left India in the hope to work on dead people's teeth.
Yeah. I thought it would be. Well, there were still teeth. I was connected to dentistry somehow.
Yeah.
But no, it was actually quite different from what I thought. I before I joined the course, I thought it was all going to be CSI and it'll be all fancy stuff. But it was far from it. And I was always very inclined towards prosthodontics. And ever since I was in my third year of dental school, I thought, one day I'll become a prosthodontist. And when I started doing this course, I was like, this is nothing to do with teeth.
Yeah.
I was doing a lot of sample collection, DNA analysis, and reading a little bit of anatomy of the teeth, but nothing that excited me too much. And then Australia, to become a dentist, although you've already graduated as one, you have to give Australian Dental Council exams. So I thought it's better if I spend my time preparing for that rather than continuing this course.
Yeah.
So then I just changed into something really basic diploma course so I could still stay in the country and, work on the Australian Dental Council exams.
Yeah.
So that was another experience, one of the most stressful times.
So what's that process like with the ADC exams? I know it's quite a lengthy process. There's like multiple exams and like hands-on components and all that.
It is. Stats say that it is probably one of the hardest exams to go through if you want to move to any other country, and also because what's involved. So I think stress gets to you a little bit as well, because you're thinking your whole life now depends on this one exam.
Yeah.
But back in the day, the format keeps changing after every few years. But when I was giving the exam about 10 years ago, we had to sit for an English exam, then you had to sit for a theory exam, and then you had to apply for a practical exam. The practical exam used to be 7 days. So First 2 days you would sit and do theory still, and then rest you had hands-on component, not so much on live patients other than perio, but exo, preps, rubber dam exercises, obturation, like excess and obturation on extracted teeth. So pretty full on. And the pass percentage has always been about 20%, 15%. So
that's tough
to crack, and it's getting, apparently from what I hear, is getting even more tough. So it was a lengthy process, but I was lucky enough to go through it and, then started working in Perth.
Yeah, that's tough because I know in Canada it's a similar process. And I have a good friend of mine, Rahul Shah, is from India as well. He was on the podcast a little while ago. And he went to Canada. And so in Canada, there's a couple of options at the time, and it's still the same in the US as well. Where you can go back and do final 2 years of dental school or do the equivalency process. So he went to school for a couple of years and did it that way. But it's funny, my uncle's a periodontist in Iran, and he's like implantologist, like just focuses on implants more. So he moved to Canada with his family, and he's trying to do his equivalency exams. So he's in there like trying to do crown preps and stuff after like 30 years. He's never done it. So he failed the first time. He wasn't too happy about it. So he's like studying again now to like try and do it again. But
funny enough, now I teach at the courses where we're training overseas trained dentists to how to sit the exams, and I have few of these specialists. I had someone from Saudi who's an orthodontist and another girl who's a pediatrician, and they're like, it's been over 10-15 years we've done a proper crown prep, and it's, although they know it all, but still it's if you haven't done it, your hand skills aren't there. Your hand skills are not there yet. So it can be quite tough, and especially for someone who's trying to change their whole life to set up something new in a different country. So it was an experience that I'll remember for the rest of my life, but it was still good. I think looking back at it, like now that everything went okay, so I think it was fine. But tough gig.
That's great. I think one of the cool things I always think about is, like when you're going through the whole grind of the whole process, you're always like stressed about it, and you're always like, oh, one day I'm going to be a dentist. And like now that you're in that position, like it's always like funny to like look back like in retrospection and be like, wow, I went through all that whole process to be like where I am today.
Correct.
So I think like when you're having like a tough day, it's like good to like wake up and just be like, remember that, because like I'm living what I was like working towards, right?
That's right.
So we got Dr. Bharat Agrawal here as well. So if we just do the same, if you can just take us through your bit of an origin story, and then we'll tie everything together and we'll go from there.
For sure. Thanks so much for having me as well, Omid. My origin story, I think a lot of people would it's pretty vanilla. I think a lot of people went through the same sort of thing. I grew up in Melbourne, did all my education here. After I finished year 12, I moved to the Gold Coast in Queensland, did my undergraduate degree there. Did that straight after school, after I finished up. I guess it probably wasn't... I guess I didn't really know that I wanted to be a dentist at that time as well. I did a bit of work experience in year 10 at school. And I loved it. I thought it was great. But I think it was probably, again, third year when you actually finally got in and started seeing patients where I was like, okay, I think this is my thing. And I guess that passion sort of developed from there. After I finished, I went straight into private practice. I had a couple of jobs. I think you sort of relate to that. Juggled a few different jobs.
Yeah, for sure.
Worked in a few different private practices. And I guess I was really lucky in the sense that I had a few really supportive and really great mentors when I first started out. And as much as I enjoyed dentistry and I worked really hard whilst I was, doing my undergraduate degree, if it wasn't for that sort of early support that I had from some of my my mentors to actually just go in and do it and, take a chance and actually do it and have that support and that backup, I don't think I'd sort of be to where I'm at today or do this, kind of dentistry that I'm doing at the moment. So from there, worked for about 4.5 years, worked for other people as an associate. And I was lucky enough to meet a couple of guys that at some point offered me a job to come and work for them as an associate. And from there, we actually went into partnership and started a couple of practices. So nice. I guess today we've got 3 practices within the group that focus on sort of all aspects of dentistry. And I guess it works really well in the sense that we all kind of have found a little niche as well. And we kind of bounce off each other and kind of building a practice that we can, I guess, be proud of.
Yeah, sure.
And it's exciting. I sort of love the business element of it. I love building that patient experience and sort of being able to curate that to my liking. But then I love dentistry just as much. There's nothing else I want to do than actually work on my patients at the same time. So, great. It's been a fairly sort of basic sort of run for me. It's been going to school, going to uni, starting work.
So you've just been crushing it the whole way through.
I haven't been crushing it. It's just, I guess things just fell into place, and I was fortunate enough that I like dentistry, which is cool. If I didn't, then I probably messed up big time. But it's been a fun journey, and look, it's still there's such a long way to go, which is exciting. So that's kind of where I'm at the moment, just working away. Working on building our practice, and just loving doing dentistry at the moment, which is fun. So
that's great.
Haven't hit a wall with dentistry yet.
That's perfect. And I think one of my favorite quotes is always like, you're the average of the 5 people you hang out with most. And for me, like personally, just through the whole process, having to meet both of you guys and hear your stories and the experiences that you've gone through has meant a lot for me, and I've learned a lot from you guys. So I really do appreciate the opportunity to be here and talk and go through your experiences and learn from you guys. So a common theme on the show is the first few years of practice, because I know that's where I am right now. A lot of the listeners to the show are senior dental students or they're associate dentists, 1 or 2 years that are into their profession. And, for me, what I'm kind of struggling with and what I'm learning now, like you said, mentorship is so important. And it's a common theme. I hear it all the time. I had a good mentor early on and it changed the trajectory of my career. And it's like one of those things where it's like, it's not like you're going from 0 to 100, but a couple of degrees over a few years, that adds up to quite a bit of a distance there. So luckily, I just got into a good associate position with Dr. Supa, and he's opening to my eyes a little bit to like comprehensive dentistry, like getting away from like, okay, what's wrong with this one tooth? How do I fix it? To looking at the whole picture. So maybe to get Bharat to start off with this, just tell me a little bit about like that first couple of years for you. What were you enjoying? What were you struggling with? What kind of courses were you kind of diving into a little bit? And what was like your steps towards like, what was your vision to like where you wanted to be like 5 years out, for example?
Yeah, definitely. I mean, I think it's those first few years are so crucial. And I think one of the big things that has sort of, I guess, being fortunate enough to be able to mentor a few younger dentists now and sort of see people go through that journey in retrospect. I finished dental school 8 years ago now. Yeah. So I'm still very early on in my career, but to be able to sort of see that from the other side now has given me a bit of insight into, I guess, what we all go through. And I think it is hard. There's a lot of dentists who graduate. It's very competitive getting a job, and we often just settle. We often get our first job and we go, okay, this is my life now, and this is my reality. And I think we have to be, I guess, a little bit courageous in those first few years and go, hey, look, I need a mentor. And if you don't have that support at work, I guess it's easier now than ever to be able to reach out to people. There's so many platforms that have opened up dentistry. It's not that isolated profession that it used to be. Same as you, just reaching out and going, hey, what's going on Instagram? Like, it's as easy as that. And I guess we're all, everyone's so approachable these days that everyone wants to share their knowledge. So if you don't have that support in-house, then look for it somewhere else. And I'm sure there's someone out there who's willing to reach out and give you a hand. And if you don't know, there's great specialists like, Varun's in a position where, he would work with several people who've just graduated, and he'd be more than happy, I'm sure, to field a phone call or an email and go, hey, Varun, I've started this, or I don't know how to tackle this. Can I send this patient to you? And can you at least give me some pointers on maybe in the future how I could handle that better? Or maybe in the future, maybe that's a case that is something that I could treat in a few years with a bit more education. Or which direction should I go down?
Yeah, absolutely. And I mean, that's one of the most important things. If you don't know what you're doing, reach out one way or the other. Yeah. And there's a lot of people out there who'll be happy to help. If nothing else, they can at least give you advice. Even if they can't see your patient, they can say, okay, do this, or definitely don't do this. Those things early on in your career, decision making is such an important thing. And as we were talking, we need to have a contingency plan. We need to know if things fail, what is going to happen. And I think that's one of the more important aspects of dentistry nowadays, that we need to have a backup plan.
For sure. And I think the cool thing is, it's like the Dunning-Kruger effect. I don't know if you guys are familiar with it. Like, confidence is like a function of like knowledge.
Totally.
Yeah. And so I remember honestly, for the first 6 months I was working now, I was like, man, I'm so good. I'm like God's gift. I'm to dentistry.
I can relate to that completely. I honestly finished dental school, and I was, I did well at dental school, and I graduated, and I was like, watch out, world. You are lucky to have me as your dentist. And it's funny how my procedures now take me longer than they used to take. I probably stress more than I used to stress. Yeah. I guess things become more predictable at some point, and to the young dentists out there, it's not going to be, it's not that stress for the rest of your life. It's a different type of stress. You walk into work and you can handle everything, but early on, it's always just like, it definitely has changed over the years. And
I think it's, again, how we were saying, it's an isolated profession because we're working on our own. We don't really say what others are doing, and we're so consumed by what we are doing, and we think we're the best. Yeah. And it happened to me as well, either one of you, is because I joined prosthodontics, and I used to think I was a very good dentist. It was not until I actually stepped foot in that specialty clinic and I realized, okay, I don't know anything about it.
The more you learn sometimes, correct, the more you realize, the less you know. Yeah, and that's where I think knowing your limitations early on, going back to those first few years, there's no shame in knowing your limitations. There's no shame in working with a good specialist. And there's no shame in being honest with your patients and going, hey, look, I can't handle this, and maybe I'm not the best dentist to be helping you with this right now, but I can support you with your maintenance, and I can support you, when you're back for your review and things like that. So I think it's important to to run your own race. And I think that's one of those big tips that I give a lot of young dentists is, it's not a race, and it's so hard these days, harder now than ever, because we're constantly exposed to good dentistry and complex dentistry, and dentistry that feel-good dentistry. You feel like this person has changed this person's life, and everyone wants inherently to be that person. You want to be your patient's hero, right? Like, you want to be the one who's going to give them that reason to smile. And I guess your time will come. There's little things you can do to work towards that.
Yeah, I mean, I think you should be your biggest critique. We can look at others' work, but again, we look at some of these amazing posts, but we don't know what's going behind the scenes, how much effort has gone in, how many hours of work has gone into making something look that good. So we need to, one step at a time. We can't just go from 0 to 100 in one go. We need to understand that if I'm here, how can I improve one step until I get to a point where I can reproduce this over and over and give my patients the satisfaction.
Absolutely. I think when you see those, you see a full archer. Like, sometimes you see Varun post a full archer preparation where he's done, you see the impression, you go, this is amazing. I can't wait that I can do this. I can treat this many teeth simultaneously and do such a great job of it. But you have to remember that going from preparing one tooth for a crown to preparing two, and then going to three, there's an exponential increase in difficulty. It's not that you've got now just twice as many teeth to worry about, or 3 times as many teeth to worry about. It's exponential. The
biggest factor is the patient, because like sometimes these procedures take a lot of time, and not every patient will cope well with it, and you need to pick and choose your patients where you can do that. It's not that every patient who needs a full mouth rehab needs to have all the teeth prepped in one go. So you have to consider what the patient factors are going to be, what the teeth factors are going to be. All that plays a very big part in that.
So I think that's where getting your picking good CPD early on is really important. And I think when you first graduate, you don't really, I speak to so many students who are so definite on what they want to do. They're like, I'm going to be an orthodontist, or I want to be an aesthetic dentist. I want to do cosmetic dentistry. And I don't think we can really make that judgment call when we're in 4th or 5th year. We've seen a little bit. We've treated a few patients. You don't really know. When you start working, you kind of realise. And I think that's where doing a bit of CPD in everything, get your basics really strong. Do some endo CPD, learn ortho diagnosis, learn how to, prepare an onlay, do a bit of everything. And I think that's what's going to make you a well-rounded clinician. And eventually when you do enough of that CPD, there's going to be a moment where you click and go, hey, this is what I love. This is what I'm actually good at. I've got a natural affinity to doing this. And then pursue that. And I think that was one of the big things for me, I love this story because it was so overwhelmingly scary at the time. I worked at a really nice practice in Brisbane City. That was one of my first jobs, and I did 2 days a week there. And I was so thankful for the opportunity to get that job. And I had a patient walk in, and it would have been week 1 of work, so I'm just fresh out, and I'm still feeling pretty confident, pretty good about myself. And she'd had 10 composite veneers done with a notable, prosthodontist, and she wasn't happy with those 10 composite veneers. And she wanted me to help her out and give her some advice on what she can do and how to fix it, and she was ready to rectify. She wanted a certain smile. And I don't know how this progressed, but I guess for me, I was like, okay, well, let's just figure out what she's not happy with. So I spent that time. I had time at that time. I wasn't busy. It was my first week of work. Spent some time just figuring out what she didn't like about her veneers, made a problem list, came up with some solutions, and she booked in for 10 porcelain veneer preps the next week. Wow. This is my first week. Nice. So I'm just going. I've gone home that day going, oh my god, what have I just done? I've cut. I've done 2 porcelain veneers at dental school. Now I've had to do 10 to replace a prosthodontist. So I went not happy with. So I went home and I had Bharat Agrawal's book on veneers. It was sitting at home. I read it cover to cover in that 1 week. So obviously I wasn't that busy either. I literally sat there and I read the whole book cover to cover. And I think I got to the Friday of that week and I called my boss at the time and I was like, so I've got this patient booked in next week for 10 veneers. I've read Bharat Agrawal's book cover to cover, but I'm not going to do it. Can you please treat that patient for me? And I think that was one of those turning points for me where I was like, as much as I could have done it and maybe I would have got a good result, I really don't think I could have got the result that I could have got if I did those 10 veneers today. And I think that was one of the best decisions I made at that point, was to go, that's great. I know my limitations. I got some education in it. And you know what? That's probably set me up for what I love to do to this day. That drove my passion. So I think for new dentists, don't do it because you can. And patients have, I guess you owe your patients that.
And I think
spending good money in.
Correct. It's all about the care about the patient. At the end of the day, we think it's about us, but it's actually about the patient. The reason why I think I was having this conversation with a few of my students at the university the other day, I was like, give yourself a few years, get out, do some work, actually really understand what you like. We always look at people who we really like and we think, oh, one day I want to be him. He's an orthodontist. Wow, that's the life I have. But you really need to work through it, because the last thing you want to do is be stuck in a profession that you really hate, because these are hard courses. Like, the hardest thing, or one of the hardest things I've done in my life would be prosthodontics, purely because there's no spoon feeding. You need to be accountable for what you do. You have to treatment plan, and these are the patients you are their last hope, almost, in a way. They are waiting years and years to see you in the government facilities, because things are deteriorating over a period of time. And then I still remember my first patient, first day of my specialty clinic, and I was a GP and I didn't know much about pros. This guy walks in, he had cleft lip, cleft palate, he had a class 3, missing anteriors and the only point of contact was between the 2.7 and the 3.7 in his whole mouth. And he walks in and I'm looking at myself, I'm thinking, where am I going to start? So these are as complex as it gets. So, but it's not about you need to. So what I did was I took some primary impressions, took some photos, and said, okay, I'm going to see you in about a month's time. And the whole month, all I did was read about how do you go from step A to step B, what diagnostics I need to do, what is the information I need before even I can start treating him. So, I think you did the really right thing by reading everything you did, but you showed that you cared for the patient, and that's why you thought there's a better clinician who might do more justice to this case. And I decided to do specialty along the same line, because I was working for about 3.5-4 years before I decided, okay, this is the time I need to do prosthodontics. But I wasn't doing full mouth rehabs. I wasn't I've done one case 3-3 because aesthetics was something that was always been very close to me. But the thing is, everything we do is aesthetic in one way or the other. Okay, it's not about if we're treating a front tooth or we're treating the back tooth. Aesthetics have different parameters. Obviously, I'm gonna spend a lot more time making the anterior tooth look good and fit into the occlusal scheme. Posteriorly, it needs to be functional, but it still needs to be aesthetic to some point, right? Maybe it's just the occlusal plane, maybe it's the height of those lingual cusps, maybe it's the inclination of those cusps. We need to know what functionally works. Is there going to be an effect from the guidance? So all those things, and I knew they existed, but I didn't know how to correct them. Yeah. And this is where I was, I used to go and observe a prosthodontist myself, whatever days I had free as a dentist. And one day, me and my wife, we were just walking around the house in the evening, and I was like, I really need to do prosthodontics. And
that's great.
And she was like, well, if you,
clarity.
She was like, if you need to do it, you've been saying it for a while. This is the time. We don't have a baby yet. We don't have anything. If you want to do it now. And rest is history. Started applying and spoke to the conveners of the courses, applied in Sydney, Melbourne, got in. Actually, I got acceptance letter from both, but I really like the Melbourne program. It just kind of fit into where I want to be because I'm a very hands-on clinician. If I don't get my hands dirty, that's it. So I thought, here the best thing about Melbourne program was that you have unlimited access to the number of patients because the patients don't have to pay the whole treatment fee. So, there's a cutoff line which is pretty minimal, and you actually get the opportunity to do a lot more. And the other factor was there were some really good prosthodontist teaching in these courses. So, my decision was quite simple. I thought, okay, I'm going to do Melbourne course, join the specialty, and I think it's the best thing I've done so far in my life. I don't regret one bit.
That's great.
Although I'm still very early in my career, but I just love prosthodontics. So every day I wake up and I think I want to do something better than I did last day. So it's good. So, but we need to think about our patients.
For sure.
I still wouldn't be afraid to say a patient if I think there is someone else who can do something better than me. I would say please go and see them.
That's great.
I think one thing Varun mentioned that was really really relates to me, the fact that he said everything that we do is aesthetic, and it reminds me. I didn't mention this when I was in my origin story, but I went back and did a master's in aesthetic dentistry.
That's right.
Via distance through King's, and one of the first questions I asked us day one when we first met was, what do you define? What is aesthetic dentistry? What is it, and what does it mean? And I think there's a real difference between aesthetics and cosmetics, and I think a lot of people get really confused. Between that, and I think it's such a distinct difference because aesthetics is everything. Aesthetics is when you treat that 6-year-old with molar incisor hyperplasia.
Nice.
Aesthetics is when you build that anatomy into that lower 7 that no one's ever going to see. Aesthetics goes on to function. There's a correlation with aesthetic function. Cosmetics and function have nothing to do with one another. Cosmetics is driven by trends, by fashion. It's driven by what people want right now. It's an emotional thing, whereas aesthetics is what we should all be practicing. No one should be practicing cosmetic dentistry. I don't think it should exist. That term is flawed in my opinion.
No, absolutely right. And this is why anything is aesthetic to a point. I'm not too fussed about putting a stain in the fissure of a 7, but having said that, the basic anatomy still needs to be there. I can't, as one of my biggest mentors in life in prosthodontics has been Dr. Andrew Flood, and I'm very lucky that I work with him at the moment. So he calls them pancake. Pancake, either it's a crown or because they look like round flat things. They have no anatomy to it. So basic anatomy, because it's functional anatomy, it's not just because it looks pretty. Yes, it looks pretty. It's a pro in that, but also it needs to function within the patient's mouth. We can't give them something, and we can't put a 16-year-old molar into a 60-year-old mouth. So that anatomy defines, but it might not be cosmetic, but is aesthetic for the patient. It fits within their existing occlusal scheme. So, you're absolutely bang on.
I love that differentiation between cosmetic and aesthetic. I hadn't thought about that before, to be honest.
It's really profound. I think that was one of the biggest things I got out of doing my master's was that change in mindset, because for me it was when I started doing my master's, based on the Gold Coast, I know you have a lot of listeners in the States and Canada, the Gold Coast is sort of the glitter strip of Australia, where it's all about everything.
Las Vegas.
Everything's bigger, everything's wider.
Yeah.
People.
It's like the Miami of.
Yeah, people want a certain look, and I did the aesthetics masters when I first started because I loved aesthetic dentistry, but I guess I wasn't super clear on the difference between aesthetics and cosmetic, and it didn't take long for us to learn that. And I think that's testament to some of the teachers that we had there. Subir Banerjee, for example, has been one of my biggest mentors, and I think he's a definition of an aesthetic dentist like that.
We've all grown up reading his articles.
He truly understands the difference, and I was very fortunate to learn from him. And I guess that sort of goes on to my next point for sort of new graduates.
Yeah.
I think it's really important to invest in good quality CPD. So early on, do a bit of everything. But at a point, I think you need to invest in some good quality CPD from, learning from the right people, people who have been doing this for decades, who've seen their 30-year, Subir can show you a 30-year follow-up of a composite he did in 88, and it looks like he can show.
This is what we want to be one day, right?
Absolutely.
Be able to show
you want to learn from these people, and I think the tricky thing is these days with Facebook dentistry and Instagram dentistry, it's very easy to buy into dogmas, but it's very easy to sort of, learn from, I guess, someone who you think has a great following, or gets lots of likes on their post. But that's momentary dentistry, and I think a lot of it is smoke and mirrors, and I think there's nothing that goes beyond actually learning the literature and learning what's worked for decades in clinicians' hands who've been doing it for decades. And I think that's really important. So there's a point where once you know what you want to do, start investing in good quality CPD and talk to people who've done it.
Yeah.
And I think it's really important to talk to people who've done courses, because there's certain courses that you hear people raving about online, and I guess sometimes you only hear the good stuff, and it's a lot of money to spend. When you're doing CPD, I think it's good to sort of be informed about it as well. So talk to people you respect, to people you value, talk to people like Varun, see what they've done, what their thoughts are, things like that. And I think it's really important to do that. So that's one of the big things, is start reading the literature, investing in the literature, because once, we were speaking about this earlier, once you can nail basic principles of what works, that's the key to success in dentistry.
And I think it's also, CPDs are CPDs, but until you actually go back the next day and start applying it, because the most important thing is not just learning from what someone else is saying, but actually going back and putting it to the test and seeing if that works for you. Because, until we practice what we've heard, we're not going to get it. And with aesthetics, I think the biggest thing is if you can't see something, you can't correct it. So it's actually appreciating, and where I think I got most out of was by doing a lot of my own lab work, because I realized that where things are going wrong, because if I don't like something, I need to go back to square one and actually start correcting it on the models before I can do it in the patient's mouth. So, and it all comes with repetition. I think it's the more you do of something, the better you get at it. For sure.
I think that's the problem with the whole Instagram generation, and just millennials in general. We just want quick answers, quick solutions.
There was a big discussion on Instagram or Facebook or something that is it a good thing that people are doing that, or is it dumbing our profession down? But I think if you really like something, and I still do it. Regardless of who's posting it, if I really like the post, I want to connect to that person. I want to talk to them. I want to know what actually went on behind the scenes to get it from there to there.
That's an important point.
Because it's not that, the patient walks in and they walk out with the best smile they've ever had. There's hours and hours of work. There's diagnostic, wax up, try-ins, there's provisionals, there's, I have a patient at the moment, so although it's not like she had the very most high aesthetic demands, but I still have at least 1 or 2 try-ins, especially for the upper interior. So there's a lot of hours spent in getting that end result, which looks good. So it's important to talk to people if you really like and understand where they're coming from and how they got there where they are.
And that's why I respect the people who post a little bit more about the process, showing the work that goes into it. Because if all you're doing is looking at before and after pictures, like it hides the true story about the work that goes into it. And I think it makes people feel bad because like I'll be like just scrolling through Instagram after work, having seen like my like MODs all day, and then I'm like, how come mine doesn't look like that? Like, because you think it's easy for them, right? But
100 photos, 99 wouldn't look like that.
but I think but also it's like you don't realize like the amount of hours, the amount of like CPD hours they've done, the amount of like repetitions that has gone into like producing that. It's not like the guy just woke up and did it on that morning, just like you, right?
Important. Like I think for a lot of the young dentists, it's don't like getting on Instagram and seeing things, and it applies to everything. It's not just dentistry. You know, it can make you feel bad about yourself and make you feel, you know, question your self-worth and whether you're doing the right thing. Are you doing your patients a disservice because your results don't look like that? I think it's important to see that as something to inspire you and to motivate you to do better when you go in the next day. And it's healthy to compete, and it's healthy to feel like you want to, you know, do as good as someone else, but compete with yourself. I think that's the most important thing. It's like, can I go in tomorrow and do it better than what I did today? Can that MOD that I did today look better tomorrow?
And take pictures. That's important.
But also on the side note, please don't criticize if you see something that you don't like, because again, the story still stays the same. Now, one of my mentors during my program, Dr. Jerry Clausen, who's a very well-respected prosthodontist in Melbourne, he said that, you know, don't look at a crown and say it's crap because you didn't do it. You don't know. This patient could have limited mouth opening. They have a huge tongue. They might not be able to open the mouth for like 2 seconds. And getting this crown on just from where the tooth needed it, and it made the tooth last for the next 20 years, it might be a big effort and, you know, a very good success story. So don't just look at someone's work. And the
I've learned that the hard way.
Yeah, don't. So, you know, one thing I and this is why when I see someone, even if the patient's referred to me from a dentist or, you know, they ended up in my book.
Yeah.
I think we're no one to judge someone's work, because until you actually start treating the patients, you don't know. Some of the patients might look like they're really easygoing, everything is fine, until they step into your dental chair and, you know, they're lying there for more than half an hour, and then, you know, the whole hell breaks loose and you're like, okay, I can't do the work that I might be capable of doing.
Yeah.
So we shouldn't be judgmental. So same thing, you know, if you like something, connect. If you don't like, please don't go ahead and start saying unless you know the whole story about it.
Yeah. So just to touch back on a few points, the point you made about the veneers, I think that's really important. I heard this in a podcast somewhere else, and it's always stuck with me. It's like your reputation is more built on the work you refer out or you don't do than what you actually do. Because I think it shows like really like deep understanding of your own abilities and like what's best for the patient. So I think that's like a really important point for new grads, especially to consider. Touching on the master's program they did, I want to just talk about that for a few minutes, because I think that's like something I wasn't aware about until I kind of talked to you. What was that process like for you? Like what? Because I know it's like a bit. I've looked into it. So it's like it's like over a couple of years part time. Quite an expensive endeavor as well. So what was that like decision making process for you in terms of like the added value that it might have for your career going into that program?
Definitely. I think for me, it got to a point where I loved general dentistry. I loved doing everything. I always had an affinity towards aesthetic dentistry, and that was something that I was passionate about. And I think there was a point where I had to make a decision of what I wanted to do. Did I want to be a general dentist for the near foreseeable future, or did I want to make a decision to go into a specialty? And early on in my career, I wanted to be a periodontist, and I don't know where that came from. And I had an opportunity to do perio, and I turned that down. But probably one of the best decisions I've made. So it got to a point where I just wanted to learn more. And I guess I didn't really know what I was getting myself into. I didn't know anyone else who had done the course at the time. It was just something to do at that point there. Yeah. It was probably one of the best decisions I made. So as much as it was done via distance, some of the people that you meet, and I think the people that you associate with as a result of it, defines who I am as a dentist today. And that's not only just the educators there, and they're all brilliant at what they do. And we were having a brief chat about, Subir and Shamir Meth and those guys. They've defined the management of wear around the world, and to actually learn from these people firsthand, there's something different that comes from that. It really enlightens you to what's possible with dentistry. I think the other thing that anything sort of, and I guess the benefit being a postgraduate coursework run through King's is the fact that it's all evidence-based, and it forces you to read the literature. It shows you it changed my approach to dentistry. I thought I knew how to read literature before I did it. And then the moment you submit that first assignment, there's red pens all over it going, are you sure you read that paper correctly? It really,
so you can't just look at the abstract?
And you can't just reference the other references.
And you have to write your thesis.
That was my go-to trick. Just go to Wikipedia and get all the references at the bottom.
So I tried that for assignment one. It didn't pan out all that well. So I think there's something that comes from that, and that was brilliant. So it was basically an application process. I got in. You go in. It's a three-year coursework. first 2 years you go over for 10 days and it's a face-to-face intensive where you do hands-on, you work on mannequins, you obviously get to meet the people who teach you, and there's usually weekly or fortnightly sort of lectures that you do online and course work along the way, so assignments, exams and case-based assignments as well, where you've got certain criteria that you need to meet and patients that you need to treat. So that's really, I guess, has shaped my sort of approach to dentistry these days. I would highly recommend it to anyone, despite the cost that's associated with it. I think you'll learn a lot from the people that teach you, but even the people in my cohort, some of them have gone on to do some brilliant stuff. Some of them had their theses published as papers in the BDJ, and to actually have met these people and to rub shoulders with some of these people who are actually defining and shaping the future of dentistry, it's really exciting. And I still keep in contact with my cohort, and they're all doing amazing things all around the world. And these are people not just in Australia; they're everywhere around the world. And those networks you build are going to shape you. This is
one good thing about Facebook and Instagram. It's actually made these people. It's very approachable. You know what they're doing, and people have access to their work from anywhere else. So, if you want to take positive inspiration, it's kind of made it
so easy.
So, no, absolutely. So these are such big names, that you mentioned, but don't forget they all started like you and me one day, and it's all the efforts that you put in.
But I think the cool thing about it is the structure, right? Because I think that's something that we all struggle with, and I've talked about this in other podcasts with different guests. Is we're so good at going through school curriculums and we excel at that, right? And once you graduate, you're kind of out in the open, and there's no structure to what's CPD. You can do a wisdom tooth one, and then like you said earlier, how do you implement that? If you do one endo course and then the next day are you an endodontist? You don't have enough depth there, so it's just a superficial introduction to a topic.
I think structured learning is really important, and that's what that gave me is that I had assignments due, I had papers to read, and it just gave me purpose. I kind of had I need to do this, I need to get through this. Whereas when you're on your own, you kind of just dibble dabble in this and do a bit of this, and there's a purpose to it. And I guess that's when when you get to third year, you write a thesis. Plenty of sleepless nights. That was not. It was fun in hindsight, but not.
And you're working full time during this time, right?
Totally. So, yeah, absolutely. So we actually started our first startup it opened doors during exams in second year. That was a whole new level of stress. Actually doing this exam, going back to this practice that's meant to open in 3 days. So it was stressful. So I took a year off between second and third year, and I think that was a good decision for me to just take a year off, recoup, work on the business, work on just my life again, having a bit of a life. And then spent a year writing that thesis, and I did my thesis on tooth whitening and the efficacy of it and what the literature shows. Cool. And did an audit within our clinic.
So while we're at it, what was the result?
I don't want to read the paper.
So few of us don't have to read it.
I'll send you guys the abstract later. So that was interesting.
Cliff notes, please.
That's it. So we did we did an audit of our practice to see how often patients were whitening, how often they were topping up treatment. And it was a bit of fun. So in hindsight, it was great, and I'd highly recommend anyone who's looking into doing any university-based postgraduate learning, whether it's a comprehensive, specialist degree, whether it's something to supplement your general dentistry. I think you should do it. For me, it's changed the way that I practice, and I guess it's more and more so now since I finished. It's opened up so many doors and so many opportunities to meet great people like you that I may not have met if I hadn't done my masters. I just wouldn't have been in that. I wouldn't have been in that mindset to be able to communicate with Varun in a way that we can relate to one another, and that's been great. So,
but I think, listening to your story, and this is the first time I'm listening from you coming, but the basic principles why we did something is still the same. We wanted to learn more, we wanted to do better for our patients, and we were at a point where we knew we needed to know more, but we just didn't know where to go. So the way to go up is learning, and either it's by CPD or any form of programs. Learning never hurts. You learn whatever. At some point it'll come in handy.
Totally.
Yeah, I think it makes you hungry for. I think if you work for a while, you're gonna stagnate in what you know and what you do. So I think it just adds that more depth into meaningful work for yourself if you want to do it that way. And I think the cool thing is just financially speaking, obviously tuition, most of the listeners are American based, or even for myself because I pay international tuition at Melbourne Uni for dental school. We have a lot of student debt. So the traditional specializing financially may not be the most feasible option, I think, because you're like $200,000 or $300,000 in debt, and then you're gonna take 3 years off work, so you have no income coming in. Plus, you're paying more tuition, and then at the end of it, it's like you're $500,000 or $600,000. Like, how do you climb out of that mountain?
I don't know. I'm my first year out, so I'm still trying to figure it out. But look. Financially, in the initial years, it might not be the best decision you make, but that you're well aware of that before you jump into it. It's not a decision that you take lightly. You have to think about it, and this is why not everyone, I can understand, specialize or go away from work for that long extended period of time. And from previous conversation, because we didn't have a baby yet, we were still quite independent, and I thought that probably would be the time. And my wife's like, yeah, that's fine. And your spouses need to be really supportive, because you can't do these programs. And I'm not as good as Bharat is. So if I didn't have a curriculum, I didn't have 5 days to go to university, I would probably complete that course in like 10 years. So I needed something that will force me to be
accountable. I
need to be in there. If it's all or nothing. There's no middle ground. And plus, I knew that and I think, as bad as it sounds, but I think my knowledge gap was so large that I thought that I need to fill in such a big void, and I need to put in the hours. I can't just do little by little. I just need to go in, head on into this. So that's when I decided to do. It was the hardest thing to do, because once you're starting to work for a few years and then you go into a full-time course. Yes, we had to sell our house in Perth. My wife left the job. I left the job. I had 2 weeks to decide that I'm going to take this opportunity that was offered to me. Because I was the last intake for the year. And, luckily the interviews cut down in July. But I was actually applying for 2016 intake. And when I contacted the university, that was towards the October of 2014. And then 2014, and then what they did was they were like, okay, we don't take anyone in without hands-on examination, so there's a 3-hour exam and an interview, so would you want to come in for one? And I'm like, okay. And I was thinking, it's a bit early for next year, but okay. So I went in December, and towards the end of December, I got the offer letter saying that we're happy to offer you a place, but it's for 2015, not 16. So I'm like, oh God, so that, and the start was March, and it gave me 2 months. But I had to tell them within the next 2 weeks that if I'm going to take it or not, because obviously otherwise they need to offer it to whoever else. I spoke to about 10 prosthodontists, and I was like, what should I do? They were like, look, it's 1 year less of pain. So you just bite the bullet, you'll graduate 1 year early. It's not going to be easy no matter when you do. And I think they had a right point, because it's not because it's pain from a point of view that it's not a good course. It's just that there's so much involved because we don't know anything about it. And there's so much to learn. My days, the reason why money doesn't come in is because not that the university says you can't work. It's just that you have no time. Because I used to have 6 clinical sessions a week. Then you have to do all your lab work yourself, from pouring the models to mounting the models to diagnostics to wax ups to special trays to preps to dyes, trimming your dyes. And but it's very important. I wouldn't have it any other way, because that taught me the importance of good impression. We were talking about full arch impressions. Now, until I have to slog through mounting that, trimming that, marking my margins, how do I know what the technicians go through? If I don't do justice to them, how do I expect them to do justice to my work? And, sometimes I had to repeat the things 2 times, 3 times. I still remember my first full mouth wax up, which took me hours and hours of time. I had to redo it, because when I tried it, I was absolutely wrong, and I did a mistake in taking the Facebook registration, and everything was canted. So we learn from those things. But it was hard. Money gap is quite big. I'm still in huge debt. I'm trying to build my way through it. I don't know how long it'll take, but I still don't regret it, because at least now what I do, I love it. So money eventually will come. Hopefully it will get to a point where we become comfortable, but I'm not thinking about it as yet, because my main focus is trying to get to the point where I want to be professionally. And they say when you do good things, money follows. So I hope it happens.
That's so good. Love that. I think that's my problem is I've only been a dentist for 2 years, and already it's like my personality. I can't get comfortable like doing something and just be like, okay, I'm just gonna do this for like 10 years. In my mind, I'm constantly like, what's next? Like, how do I do this? What do I do that? Like, what do I side hustle? Like, so I think it's such a good approach to have. Let's just love what you do. Like, get your day job sorted first, get that tight, and then worry about other things on the side. I think it's like a more admirable approach to like kind of
absolutely
being happier at work.
I mean, it's very stressful as well. Like, because I'm at a point where a lot of the cases are where things have gone wrong from every aspect that they could be, and then you're trying to figure out this puzzle and see where you want to go, and so it can be quite stressful. Yeah. But still, if you really love what you're doing, it keeps you going. It's not that I come out in the day and hold my head and like, what am I doing? Why? We all have hard days. We're all going to come out of these patients, after treating a patient and you're like, oh, thank God it's over. It's not because we don't love what we do. It's just a hard patient or a hard case is always going to be difficult.
For sure.
It's a tough gig. And I think for new grads, you're going to realize that it's actually really hard.
It's a hard job.
And I think we need to sit back and acknowledge that. You're going to have bad days and you're going to feel rubbish about yourself. You feel rubbish about dentistry, but that's not the be all and end all, right? Exactly. You're going to have tough days. It's going to get better. And like I said, it just gets more predictable. You get to a point a few years later where you're like, oh, I'm not thinking about those 10 things I thought about every day when I first went to work. It just becomes second nature.
The growth is great.
You got to just hang in there, hey. And acknowledge that it's hard. Sometimes it's not going to be perfect.
For those, if you know something is coming and it's going to be, or you think it can be difficult, just think about it. Even now, if I have a big case in the morning, actually subconsciously, even when I'm sleeping, I'm thinking about things that are going to happen
all the time.
I don't think it's mentally that nice. We're taking all the stress, but it's pre-planning. If planning to get something right, and you need to visualize, I'm going to do first step, second step, third step, and then if you go and apply it, hopefully it takes a little bit of anxiety.
That's something that I've been doing recently. Like when I know I have a big case coming up for the day, and like you said, because it's not like I've done it hundreds of times. Like maybe I've done it a few times. So in the morning, I should wake up earlier, and I'll try and visualize the procedure in my head. All right, so I'm going to tell my assistant have this, and this ready. I'm going to do this first.
Absolutely.
And then when you do it and it orchestrates perfectly to what you envisage, it's wow, that's a cool.
I go and make a list for my
days. Down,
I go and list everything that needs step by. So because I want them to be anxious as well. Patients can feel it. If you're anxious with something and although you can mask it all, but if you have a system through, it just makes things.
And I think it's also nice that if you have those lists, if you forget something, it's always nice if you just turns around and goes, "Hey, Brian, you got step 3."
Shade guide. The amount of times I've done that. But one time I ran out into the parking lot. I'm like, I need a shade. Come back soon.
That sounds terrible.
Sure it's happened to everybody.
Not as bad as that time where I got 6 teeth into a bonding case, and my nurse and I both realised that we forgot to put bond on the tooth. So, luckily, the patient was in the dental industry, so she just looked up. She saw both of her eyes, and she's like, What did you do? And I'm like, oh no. And you'd be surprised how strong the bond between etched enamel and composite is, because it took me so long to take off.
That's amazing. I like
it happens to everyone.
That's why I think it'd be a happier place that everyone shared failures more often, because I think because of Instagram and Facebook and stuff, you always see perfect.
It's a highlight reel.
I screw up all the time. How is nobody else screwing up?
Everybody does.
So it's good to hear that. All right, so I wanted to move this along. It'd be interesting to get your perspective on this. So I want to talk about an average week, for example. Brad, you're general dentist, focus on aesthetics. Practice owner as well, so you have that added stress of the managing staff and all that. So talk to me about your average week, and then we'll get into Varun as well after that.
I think for me, I'm still figuring it out. For me, this year's been a big year. I've cut down from doing 5.5 clinical days to 4 clinical days, and I think it's really helped with my work-life balance. So my average week, I still do pretty much all aspects of general dentistry. There's lots of stuff that I still refer out to specialists that are beyond my scope, or within the practice. There's things that I do less of now than I used to do more of. But for me, I do 4 days. I work fairly long days when I do those 4 days. And for me, it's all about, if I'm going to be at work, then I'm going to be there and be present and do as much as I can in that day. And for me, I guess from there on in, there's a lot of stuff that happens from a business aspect. I think as a business owner, there's a lot of things you learn about as you go along as well. There's decisions you're making in between patients when things are, falling apart with, a staff member. If there's something else going on, there's other things you're controlling. So there's a lot of stress that's associated with that as well. But average week for me, I'm doing all aspects of general dentistry day in, day out. And look, I mean, for me, I guess it's become nicer in the sense that I guess due to word of mouth and referrals from other clinicians as well, that I'm doing more of the stuff that I like. And I think that eventually happens for most people as well. As once you find your niche, you just find that you're doing more of it. More of your patients are talking about it to other people who come in wanting what you're doing for them.
I think still word of mouth is the biggest thing. I mean, patients, if they like your work, they're going to tell 10 other people, and they're going to come and see you for it. So word of mouth is important, and that all comes down to how good you are in doing what you're doing.
Well, it's been exciting. I think I've finally sort of built that sort of ideal patient base where I can confidently say that I love like most, if not all, of my patients. Because they are patients that I've seen, I like them. They've referred patients that are like-minded to them. Yeah. And it's got to a point now where my book is full of those patients that I see day in, day out, which is really exciting. And obviously there's the anomaly here and there, but, I think building your ideal patient base just takes time.
After a while, they become your friends.
Yeah, it's fun.
You've seen them long enough. And
kids that you've seen grow up, since, go through school, get their licenses.
So what's your books like? Are you, obviously, I think doing like the master's degree and like doing the bigger cases that you're doing like enables you to see less patients in a given day because you're just doing bigger and bigger procedures. So what's that like average kind of day in terms of like workflow?
Yeah, so we try and pre-block appointments. So I'm seeing still a bit of everything. I don't want to not be able to see my new patients where I need to. So I'll see a couple of new patients, most days. I still do my own hygiene as well. So I'll see my hygiene patients. And then usually there'll be, one or two sort of, big cases, most days where I'm either doing some bonding and I'll sort of spend like, 2 or 3 hours with a bonding patient, for example. If there's an indirect booked in, I still, I used to book in an hour for an indirect. I book in an hour and 15, hour and a half now. It takes me longer to do these things. But my average week, there'll be a couple of bonding cases, a few indirects here and there. Nothing out of the ordinary that, anyone else would see. But I guess it's just, you get to a point where you can spend a certain amount of time, which warrants a certain amount of, I guess, financial reward for it as well. So there's, I guess, you eventually build value in what you do. So you can afford to start seeing less patients and do better quality work because your patients are happy to pay a premium for that service.
And that's like the dream.
And it just comes with time, and it happens organically most of the time. You just get to a point where you're like, this is, people are happy to pay a premium for me to do this for them. And patients are happy.
That comes with time. So, first you need to focus on doing good work until basics. You get your name there, because now you're at a point where, people want to see you. You'll become a brand in a way, and then, they know how good you are, so they'll do anything to, for you to work on them. So, but initially, our focus should be actually doing good work.
Absolutely.
And not thinking money. But
like
as
walk
I
before
said,
you run. Yeah.
Once you are there, once you're in your position, then you can do whatever you want.
Excellent. Crawl before you ball, can't you?
Shout out to you.
Shout out to you.
Where's the album? I thought it was supposed to come up. Talk to me a little bit about the Invisalign thing, because I know that's something that you've seem to be doing a lot of. How was that sort of growth for you? Like, where did you get the background in that to
so I was really lucky. So both of my business partners do a lot of Invisalign, so I had that support in-house to actually sort of learn a lot from them. Invisalign has changed the shape of our practice and the way that we actually treat our patients, and it's gone from that interdisciplinary approach where so many adult patients who have a cosmetic or an aesthetic discrepancy, it's actually born from poorly positioned teeth. So Invisalign's become this. Invisalign for me isn't so much the be all and end all when it comes to sort of patient getting their smile. It's just part of the armamentarium to get them to that end point. And I'll often find that patients are so receptive to the notion of minimally invasive dentistry and how tooth pre-prosthetic tooth alignment can actually help them get an outcome which is more functional, far more aesthetic, and likely going to be far more long lasting. Or minimise the need for complex, restorative dentistry entirely. So for me, it's been an absolute game changer. And for me, I feel very comfortable treating, I don't treat all aligner cases, and I work really closely with, some great specialists. And that's really changed, again, the dynamic of our practice. There's such a big turf war that sort of under the covers that no one wants to talk about between specialists and generalists, but we don't feel that in our practice at all. We're an all-encompassing, comprehensive practice that has a great brand for delivering all aspects of dentistry, but we still have these brilliant links with specialists around us. And I think specialists enjoy working with us as much as we do, because we're actually pre-planning these cases and going, hey, this is beyond my scope. I can't do this. I can't get this patient. Yeah. But we'll have planned everything else, to a T, where, hey, move these teeth to this position. I need 0.4 of a millimetre distal to that lateral. And specialists will love that. And I think that's such a big take-home thing for so many people out there as well, is, even if you want to be that all-encompassing general dental practice that does everything and you want to keep everything in-house, you can still do that. You can still comprehensively plan patients, and patients will love you when you go, hey, I can't do this bit here, go and see this person over here to get this thing sorted, and then come back to me. I'll do B, C, and D of that treatment plan. Invisalign has been a great addition to our practice, and we do. I guess we're doing more and more of it every day. It's brought us into the digital world as well. We weren't looking at digital until we started doing Invisalign. We've got 3 scanners in our practices now.
Nice, yeah.
And it's just changing the way that we practice every day. We scan a lot of our patients for actually just even visualizing, what's possible. Things like the Invisalign outcome simulator, they can see it on the spot.
So do you routinely iTero scan all the new patients as a part of the new patient exam, or
not every single patient, but more and more so. Anyone who's got complex needs, I'm finding once I've got that digital scan, it makes it easier for me as well. I can start working on these patients when they're not in my chair as well. It's an absolute game changer. I can literally diagnose.
It's almost as close as taking the patient home.
100%. That might not be great for work-life balance, but at the same time, if you've got that 3D model, I can sit there and move it around. Patients can see those things just as clearly as we can. We're trained to see it, but they don't know until they can see it. So I would say that I probably scan between 50 to 60% of my new patients now.
That's great.
And even if it becomes a record long term, where God forbid they get in a car accident, I've got a 3D scan. I can reprint a full arch prosthesis that looks exactly like the original.
That's so cool.
It's opened up a lot of doors for us for sure in Invisalign, and it's been fun sort of getting involved with some of the teaching and educating, and I guess really perpetuating that notion of minimally invasive smile makeovers. There are so many adult patients that can get away with a bit of alignment, a bit of bleaching, a little bit of bonding, a little bit of recontouring, maybe a little gingival recontouring here and there. And these patients traditionally walked out with 6 to 8 prepped veneers. And when you've got a patient, my patient base is predominantly young. I'd say I'd see predominantly 25 to 35, 40-year-olds in my practice. It would be an absolute travesty if I was consistently cutting veneers or doing veneers on these patients. Most of them don't need it.
That's so good. I think it's a responsible thing. It might be more work for you up front. It might be easier to prep it, but I think, like I said, long term that'll do.
Totally. Your result is never going to be that good. If the teeth are in the wrong place, they're in the wrong place.
Totally.
You can't prosthetically put anything to make it 100% correct until you might still be able to do veneers or whatever, but if you bring the tooth to the right place, in the position where you need to be, one, you're going to be less invasive. Second, your outcome is always going to be much more superior.
Yeah, absolutely. The beauty of it's a journey. The patients go on the journey with you as well.
And they see it.
Totally.
See it.
They love because that's something that I've started doing recently, it's tough because I'm working in different practices and I'm seeing both sides of dentistry at the same time. So one is more corporate based, 30-minute exam and clean. I'm what am I supposed to do in this 30 minutes? You don't have no time to be any comprehensive. So you're just being reactive. Okay, you got a chipped tooth there, a cavity there, but you don't have no time to be more comprehensive. Whereas in the other practice, I have some good mentorship, taking full serious photos, we're doing scans. And I tell the patient, there's a lot going on, let me bring you back next week, we'll go through everything. And I'm just it's crazy. I'm booking these insane cases that I would have some of it I don't do myself, I'll refer off, but just the fact that I'm putting in the time to be comprehensive about it, it's fun for me too. It just changed dentistry for me last few it's less than a month, so early days, I know, but it's something that's quite exciting.
I think, in your first exam, regardless of what it is for, you need 60 minutes on it, because it's the time also you develop the rapport with the patient.
Absolutely.
Because that first impression is so important, and this is, I'm going back to my general dental days, and even now my consults, and sometimes they're even more than an hour long, because it depends how complex the case is. But I was very lucky, whoever I worked for, they always had the same model as, exam and clean, 60 minutes. Even if I don't do the clean there, at least I'm getting all the records, I'm sitting and talking to the patient, I'm understanding what their needs are, because one thing is telling them what they need in the mouth, but also is listening to them and to what they want. Mm-hmm. Because then you got to put those two things together to come up with a treatment plan. Because if you're treating all the teeth which not concern them, and their concern was that one discolored anterior tooth which you have not done anything about, they still haven't got what they wanted. So, understanding your patient is very important, and that's why you need that time.
Yeah, that's cool. I think I'm on that. I know I'm like very early in the stage, but I'm on that growth trajectory. So honestly, this master's thing seems pretty appealing. Just the fact that I can see where you are in your career now and like all the stuff that you're doing. To me, I'm like, that'd be cool to do that. Like if I go through this course and it gives me the tools or the knowledge to be able to like actually apply some of these things into practice and do some bigger cases.
It'll give you the ability to see what's possible. And I think even if it doesn't give you the tools, I think postgraduate course ever spoon feeds you anything.
Yeah.
But it'll teach you to be more aware and more conscious, and you'll go, hey.
It'll force you to read more and see more.
Yeah, totally. You'll ask more questions.
Absolutely.
Yeah.
That's so cool. All right, Varun, how about yourself? So I know you're, first year of being a prosthodontist now. You're working.
I'm a newbie as well.
Couple practices. So talk to me a little bit about what that process has been like for you, like your average week, how the referral process has been. And one question I wanted to, if you can incorporate that into it, is how can a general dentist kind of like improve their workflow with a specialist, with a prosthodontist? How can we kind of work together to get a better outcome for the patient?
Sure. Look, my days are a little bit more varied than Bharat's, because one, I'm not just at one place. I'm at a couple of practices where I'm going out. So my average week would be 3.5-4 days of clinical work, and I teach sometimes a day or day and a half at the university, depending upon week to week, and then sometimes I need to make time for admin. So, I still take work home, which I shouldn't, but I have to sometimes. At the moment, it's not that bad because, as I'm still newly graduate, I'm finding my feet. I'm starting to, build up my practice base as well. So, but days can vary, man. Like some days I have to see patients where I'm seeing the whole patient for the whole day, or at least the afternoon, depending on what I'm doing. Like Bharat said, we still need to have some slots for those new patients, because if my referring dentist or someone else wants the patient to be seen quickly, I should be able to incorporate for that. That's very important. As far as, life, otherwise working life is pretty good. I mean, I enjoy what I do. It can be stressful, but depends on the case. If there's a difficult case, there's only so much you can do about it. It's going to be hard, appointment. You got to get through it. You got to explain to the patient, talk to them. I think what I find is I am doing a lot more talking in the initial first 2 visits. It's all about conditioning your patients. You making them aware of what they're presenting with, what complexities, and also setting their expectations, because if someone like Bharat, let's say, who's so good at what he does, he sends me someone who's not happy aesthetically, I have to look at it, can I really do anything better than he's done? But then it's not about achieving the result, it's actually about understanding the patient and talking to them and conditioning them back to limitations, and telling them, hey, I don't think I can do, and if that's what it is, you need to tell them, I don't think I can do anything better than what you already have. So, that's where my days are. A lot of talking, a lot of diagnostics, a lot of presentations. And then when it comes to work, it depends on what kind of work it is.
Yeah.
I don't like a full day patients. Like usually I try and avoid it because I don't think it's nice on the patients. But in certain cases where you might be at this time, the patient wants to get it done quicker, or you think it might be a better situation, then you do it. Mm-hmm. But I think my break from that is when I go and do the teaching, because I'm a very big believer, like if you have something to offer, you should always go and do. Yeah. It's just, a bit of form of giving back to the students. Hopefully, if we can teach them 1 or 2 things which they can take along, and that might improve their working career.
Yeah,
and,
that's so cool.
It's all worth it.
And I think it best applies to both of you guys. Like there's certain people that you meet and you're like, these guys are like just passionate about what they do, and like it comes through clear with you guys. And I think it's very admirable that you guys are so open to like teaching and helping others as well, and not just be like, no, this is my knowledge, I'm gonna keep it for my own like fulfillment. And that's something like I love teaching myself, but like I have nothing to teach yet, so I'm trying to learn stuff, and I'm like, okay, one day I'll know enough about something.
And I'll just also, coming back to it, what you asked, how the working relationship between GPs and dentists or prosthodontists can improve. Look, I think it's about understanding that I'm a very big believer of because we work in a secluded environment where no one is always looking over your shoulder and saying that, okay, this is good, this is bad. So you need to be your own judge. You need to make those decisions yourself. If you feel at any point that, I don't feel 100% confident, even if it doesn't mean you have to refer the patient, don't be afraid to pick up your phone and just call whoever the specialist you work with, because that's what I did when I was an undergrad. Like, I still remember talking about implant crowns, and I was doing my second or third implant crown, and I put that driver wrong, and the screw head spun, and I was like, oh my God, I think it's torqued, but now I can't engage it. What happened? And, like, I don't know if I should defer, if I should do. What I did was I picked up a phone, called a prosthodontist. I'm like, this is what happened. He's like, look, if it's torqued down, you've looked at it, it's fine, because first thing that will happen is the screw, if it's not torqued all the way down, it'll come loose. It will be much easier to retrieve it then than trying to now go and dig it. So keep an observation, tell the patient if he feels that, give them my card if you want me to see them, and tell them to come and see me, and I'll see them right away. So, it's about communication, and that puts you to a rest, and also the patient knows that, they're going to be managed one way or the other. Yes, it's a complexity, but complex situations can happen. So as far as GPs, I think, just be open. If you have any questions, either way, just don't feel afraid to give anyone a call, and they will always help you.
I think one of the big things you said was communication. I think one of the biggest things that changed my relationship with specialists around me, and I say this to all of my associates who work for me, is actually writing reports back to your specialist. You guys spend so much time treating our patients and then writing a report to tell us what you did and how it went, and often it's lost after that. And I always think about my endodontic colleagues who do these beautiful endos for my patients, and I guess they have no idea what happens next. How terrible is that crown that I'm about to put on there? That's going to compromise everything they've done. But if I can send them a post-operative baseline bite wing, or a quick photo of what I've done, at least it gives them some reassurance that their beautiful work has been taken care of on the other side. Or with an orthodontist telling them how much, how big a space I need, or what the plan is afterwards. I think that changes everything. The moment you start communicating, they'll come back to you. And I don't know how you feel about this, Varun, but
no, I totally agree. I would, as much as I would not like to, but let's say if someone has referred a patient to me for a crown or whatever, I've done that. I can't see this patient on a regular basis. They're still going to go back to you, and you're going to be maintaining it. I would still like to know how the patient is going.
Totally.
Just it makes you feel good that everything is good. It's being followed up, and I'll tell the patient, okay, I'll see you once a year just to have a quick look to make sure things are not going wrong. But it's always good to hear back. Like even if it's not going to change your life, but it's good to know that the patients are in good hands and they've been getting followed up. Even if it's to say the crown is still going okay.
Yeah, absolutely.
So that's all, and just makes you feel better that work is still getting looked after.
That's perfect. So before we wrap things up, I just want to quickly get into future plans for both of you guys. So if you want to just share with me, like, if you have something that you're kind of planning for, like, say, in the next 5 years, hoping to achieve professionally.
5-year plan would essentially be one, obviously establish myself more as a prosthodontist, because as I said, I'm still a newbie in the game. I'm still finding my feet, and also eventually the long-term plan is to own your own practice, have something that you can then have more control on, just so that I can design it the way I want. Ideally it would be 4 days of practice and 1 day of teaching. That's where I would want to be, because I think no matter how busy or not I get, I would still want to have 1 day of teaching, just to give because I learned from a lot of good people who motivated me. So that is one of the part of where I see myself. Like, if I can be there to help someone in their early careers, hopefully it'll make some difference, because definitely did to my life, and I learned a lot from good people. So.
That's great. What yourself, Brad?
Look, for me, I think a lot of it is, keep growing with the businesses. I absolutely love what we've built, together with my partners, just keep growing, get on more associates, see more patients. So that's a big thing for me over the next 5 years is, how big can we really sort of build our practices and, I guess continue to deliver that sort of value and quality. Personally, I guess very, very similar to Varun, I think my ideal work week is that sort of 4-week work week, and just start teaching more and start educating more, and hopefully have some sort of impact on the others around me.
I speak for both of us, and this is why we decided to do the study club, is because, I think we need to give back. And it's a very important aspect, because things that I can tell people now, hopefully if I knew 7-8 years ago, I might have been on a much higher level of education by now. Like, I might have understood things when I went into the program. I might have been a bit more better clinician, and it might have given me a bit of pace. So I think teaching is very important. If you think, as Ahmed, you're saying that you don't think you have something to offer, but believe me, I think you do. Okay, and how many people can actually sit and do a podcast? I mean, this is a very big skill, and you are bringing all this knowledge to all the others in the around the world.
Yeah.
You have how many 66 countries or 69 countries now? So like this is a big achievement. So
Thank you, appreciate it.
yeah, absolutely. I think you're doing great, and hopefully we can just continue doing this, and hopefully we can make this newbie podcast or newbie study club into something that people get value out of. I think that would be a good idea.
For sure.
To,
yeah, I'm excited for the first event. I think people will get this episode out before the event comes out. I think a lot of people will listen to this episode and will get excited to come out and actually see you guys speak and teach all the things that you've learned from your experiences. For me, like just doing this is, one of my favorite quotes was Bill Gates was saying find any hard task and find the laziest person and because that's me, I'm the laziest person, so I instead of reading articles and stuff, I'm let me just talk to someone who knows this stuff and I'll just learn it from them. Exactly. And then I'll just put it out so other people kind of get some value as well, so it doesn't hurt, right? So I appreciate you guys coming on today. It was a great conversation. We went over almost an hour and 10 minutes, so I think that's quite exciting. A lot of good topics and pointers that we kind of touched on. I think a lot of people get a lot of good value. Now, what I've been doing the past few episodes is just ending off on a bit of a rapid fire here. So I'll just ask the same question to both of you guys, just a quick answer. So Brad, what's your favorite pizza topping?
Jalapenos.
Jalapenos?
Salami.
What's your favorite Instagram account to follow?
I'm going to give it, this is a bit of the bromance.
Yeah.
Dr. Johan. Sure.
Yeah. he's a great account to follow for sure. Varun?
I don't know. I don't think I have a favorite one, but Dr. Gotsu from the Prosthodontist from Canada, I like his work. Yeah.
He does great work. Yeah. What's your favorite tooth to work on?
I actually think the 1-4 has the nicest occlusal anatomy.
Yeah.
Love-hate relationship, central incisors.
Central incisors? Okay.
Yeah.
And what's your favorite procedure to do that you could do all day, every day?
Bonding. If I have my brush and some composite, that's what I want to do.
Probably either composites or interior ceramics.
Interior ceramics. And what's the one procedure that makes you question why you're doing dentistry?
Endodontics.
Endodontics.
I don't know, man. I'm because I'm not doing general dentistry. I'm focused to prosthodontics. But I think orthodontics, I never had much of interest. Although I love working with them because they bring the teeth to the place where but I can't do it.
What is the one, what would you be doing if you weren't doing dentistry?
I reckon I'd be a graphic designer.
Graphic designer?
Yeah.
Neurosurgeon.
Ain't mine.
Yeah, exactly. That doesn't hurt. You can say whatever you want.
Awesome. Guys, thank you so much. It was a great episode. I'm excited to get this out there and get some good feedback. I'm sure a lot of people will hopefully reach out to you guys with follow-up questions and everything. So the event is Introduction to Aesthetic Dentistry, October 29th. Dr. Bharat Agrawal, Dr. Varun Garg are going to be there dropping some serious knowledge. I'm going to be learning, so for me it's some free CPD, which is sweet. So hope you guys can come out as well and learn a thing or two. And what we're hoping to do, how we're trying to be a bit of a disturber in this space, is actually teach in a way that you can apply it the next day. Like you talked about earlier on, it's one thing to go to CPD, but it's another thing to actually go and learn actual tips that you can actually apply in the workplace the day after. So hopefully that's what we can kind of accomplish with this first event and sort of see where things go from there.
Absolutely. And I mean, with aesthetics, and this is why we chose this topic, is because, seeing is believing and doing. So if you can't see it, you can't change it. And hopefully after this, you'll be able to pick up one or two more things about aesthetics. And if we can help you along the way, that'll be great.
Absolutely. Can't wait for it. It's going to be a good event, hopefully.
Awesome, guys.
Thank you.